Howdy, Bestie viewers! Did you know that your liver contributes significantly to your overall health? It's responsible for processing nutrients from your meals and washing out the harmful toxins in your body. However, when your liver is not operating correctly, it will try to alert you in a variety of ways. It's important you don't disregard these clues, no matter how subtle they may be. In today's video, we'll be discussing common liver damage symptoms and how to spot them. Is weight loss a sign of liver disease? What about bloating? We'll talk about all of this and more. Number 1. You have dry eyes or dry mouth. There can be a variety of causes for dry eyes or dry mouth, ranging from your age to medications you're taking. But one cause is far more serious. The condition is called primary biliary cholangitis, or PBC. It's an autoimmune chronic liver disease that mostly affects women. It's caused by damage to the bile ducts. Fortunately, dry mouth and eyes are an early indication of this chronic illness. If you feel you have PBC, make sure you talk to a doctor ASAP. Have you ever suffered from PBC? Sound off in the comment section and start a conversation with our bestie community. Number 2. Your urine is darker. Seeing darker pee in the toilet after using the restroom can be scary. It's also one of the telltale signs of liver disease. Studies have investigated this over the years. Bilirubin is responsible for the yellowing of the eyes and skin, but it can also affect the color of your urine. Urine that's dark orange, amber, or brown may indicate liver illness. The color is caused by too much bilirubin. Since the liver isn't breaking it down properly, it's collecting. If your liver's in good condition, it'll eliminate the majority of bilirubin from your body. This chemical substance can seep into the blood and urine if your liver is injured. Number 3. Aches and pains. You haven't been working out more than usual, so what's the deal with all this pain you're feeling? This is once again thanks to PBC, which can cause bone, muscle, or joint discomfort in addition to itchy skin. The need for treatment for acute cholangitis cannot be overstated. Your doctor may have you take antibiotics for up to 10 days. Number 4. You're getting confused. Now, there are plenty of reasons for confusion. Sometimes you're simply stressed out. Other times, it's something much worse. Hepatic encephalopathy is the deterioration in brain function caused by serious liver disease. In this state, your liver is unable to eliminate poisons from your blood. This results in the collection of toxins in your bloodstream, which can harm your brain. Unfortunately, this condition can also impair your ability to understand information. This might cause you to be confused by things that don't normally confuse you. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all of our great bestie content. Number 5. Prone to bruises. As your skin thins out with age, your body may begin to bruise more easily. But if your body is bruising out of nowhere, it may be a sign of liver damage. Because your liver doesn't create enough clotting proteins when it's damaged, you may bruise and bleed more than usual. Excess bruising can be caused by a variety of diseases, so consult your doctor if you experience this symptom. Number 6. Breasts become larger. If you're a guy, swollen breasts are one of the most surprising warning signs of non-alcoholic fatty liver disease. It's a strange phenomenon, but there's a reason behind it. Excess breast tissue is said to develop as a result of an imbalance in estrogen and testosterone. Studies prove that patients with alcohol-related liver disease are more vulnerable to this. Phytoestrogens in alcohol, along with ethanol's direct suppression of testosterone production, further disrupt the estrogen to testosterone ratio. Number 7. You lose weight unexpectedly. If you're committed to your workout routine, don't be surprised if you shed some well-deserved weight. Unexplained weight loss, however, is usually a cause for concern. A fair rule of thumb is to talk to your doctor if you've lost a considerable amount of weight, more than 5% of your body weight, in the last 6 to 12 months. Losing weight unexpectedly might be one of the symptoms of liver disease. Seeing the number on the scale drop isn't just a sign of liver cirrhosis, it's also a warning of hepatitis C, a viral infection that causes liver inflammation. Before we move ahead, here's another video you might like. Watch and learn 12 unexpected ways to detox your body naturally in 24 hours. Now back to our talk on warning signs your liver is sending you. Number 8. Your eyes and skin are becoming yellow. Seeing your eyes and skin turn yellow can be terrifying, but there is an explanation for this. It's called jaundice, ladies and gentlemen. Remember bilirubin from a moment ago? Jaundice is caused by a high level of bilirubin in the body. If you do see the discoloration, it might be caused by a variety of conditions, ranging from cirrhosis to hepatitis B. The World Health Organization estimates that 354 million individuals worldwide are infected with chronic hepatitis B and C. For those of you who don't know, hepatitis B is a viral illness that causes inflammation and damage to the liver. Inflammation is swelling that happens when bodily tissues are harmed or diseased. Organs can be damaged by this inflammation. Number 9. You're exhausted all the time. Have you been feeling tired recently no matter what you do? It's possible that liver illness is to blame. Studies state that chronic weariness is one of the most common symptoms of liver impairment. It may be caused by changes in neurotransmission within the brain. Number 10. Your sleeping patterns are off. Not being able to sleep can have a terrible impact on your quality of life. Liver cirrhosis has been linked to a number of sleep disorders. Research has discovered that liver cirrhosis makes it extra difficult to get a good night's rest, even if you're going to bed earlier than usual. Insomnia, excessive daytime drowsiness, and sleep-wake inversion are the most common problems you'll run into. Number 11. Goosebumps. Are you constantly getting chills even after putting a warm blanket over your body? It might be a sign of something called cholestasis, which happens during liver illness. This occurs when the organ's bile flow is limited or completely stopped altogether. Cholestasis refers to any situation where the flow of bile is delayed or interrupted. Bile flow can be obstructed in the liver, outside, or both. Studies show that cholestasis is caused by a wide set of disorders. This includes viruses like HIV and hepatitis, as well as bacterial infections. There are some autoimmune diseases, such as primary biliary cirrhosis, where your autoimmune system attacks and damages your bile ducts. This can cause cholestasis. Apart from this, liver and pancreatic tumors also lead to this issue. Number 12. Constant bloating. Bloating is a pretty common feeling after eating, but if your bloating isn't caused by a large meal, it may be due to ascites, a collection of fluid in the belly. Although it can be caused by a variety of medical conditions, ascites is most frequent in people with cirrhosis, which is severe scarring of the liver. In general, the presence of ascites signals advanced liver disease. Ascites can also be caused by blood clots in the veins located in and around the liver, as well as some forms of abdominal tumors. Since bloating is one of the warning symptoms of liver damage, it's a good idea to schedule an appointment with your doctor just in case. Number 13. You can't concentrate. Let's be honest, everyone has struggled with concentration at one point or another. Sometimes your brain just doesn't want to operate and you can't focus on the task at hand. However, if you're having problems concentrating on a daily basis, it might be a sign that your liver is deteriorating. Number 14. Your palms get red. Sometimes the worst red flag is redness itself. Do you have red palms for no apparent reason? It might be related to non-alcoholic fatty liver disease, where too much fat has accumulated in the liver cells. It can affect people who don't even drink. You need to understand that if left untreated, liver-related concerns can have long-term consequences to your health. If you think you have a liver issue, make an appointment with your doctor as soon as possible. In most situations, quick treatment is needed for a speedy recovery. Here's what else might help you. Check out 10 warning signs your liver is full of toxins. Or how about 9 foods that make your liver stronger? Go ahead, click one, or better yet, watch both and learn how smart decisions can reduce your risk of disease. Do you or anyone you know suffer from liver problems? Let us know in the comments below.